In Vienna, in the spring of 1847, a young Hungarian doctor named Ignaz Semmelweis made an observation that should have changed the world. The maternity ward where physicians delivered babies had a mortality rate of around 20%. Women died of postpartum fever within days of giving birth. The maternity ward where midwives delivered babies, in the same hospital, same building, same era, had a mortality rate of around 2%. Semmelweis figured out why. The physicians performed autopsies in the morning and delivered babies in the afternoon. They did not wash their hands between the dead and the living. He instructed them to wash with chlorinated lime. The mortality rate dropped to almost zero within months. His colleagues laughed at him. They had him committed to an asylum. He died there in 1865 at the age of 47, beaten by guards with infected wounds. The medical establishment did not adopt hand washing until decades after his death. Now, here is the part of the story almost nobody tells. 800 years before Semmelweis, a Viking midwife in Iceland was already delivering babies in a hot, smoke-sterilized bathhouse. She washed her hands in scalding water. She used birch branches that contain natural antimicrobial compounds. She cut the umbilical cord with a knife passed through fire. She had no germ theory. She had no scientific journal. She had no Vienna medical faculty to ridicule her. And her patients survived. By every law of recorded medical history, this should be impossible. The Vikings had no universities, no medical textbooks, no Greek-Latin theoretical tradition, no Galenic anatomy. They worshipped Odin. They read no Hippocrates. They had, by every Western academic standard, a primitive folk medicine. And yet, for 700 years, while European doctors bled their patients to balance imaginary humors, while they declared bathing dangerous, while they prescribed mercury and arsenic and dried toad, the Norse were quietly doing things that worked. They washed wounds with honey. They packed cuts with birch tar. They induced controlled fevers in steam rooms. They drank fermented liquids that, by accident, killed waterborne bacteria. Plague, sepsis, childbirth fever, surgical infection. Pick your poison. The European medical establishment had a confident, theological, university-approved answer for each one, and almost every one of those answers was wrong. But here is what actually happened. The Vikings were not smarter than medieval doctors. They were operating from a completely different epistemology. One was empirical, what works gets repeated. The other was theological, what the ancient Greek authorities said gets repeated. And for 700 years, the empirical system quietly outperformed the theological one. And the medical establishment did not just ignore this. It actively suppressed every doctor who tried to point it out, until the 19th century made the suppression untenable. So, what did medieval doctors actually believe, and how badly did it kill their patients? Let's start with the theory. Medieval European medicine was built on the work of one man, Galen of Pergamon, a Greek physician who lived in the 2nd century AD. Galen wrote prolifically about anatomy, physiology, and disease. By the medieval period, his works had been translated into Latin and Arabic, and they formed the foundation of every medical curriculum from Salerno to Paris. To become a doctor, you studied Galen. You did not question him. You did not test him. You memorized him. Galen's central theory was the doctrine of the four humors: blood, phlegm, yellow bile, black bile. Health was a balance of these four fluids. Disease was an imbalance. Every illness, from a fever to a tumor, was traced back to one humor being in excess and required draining. This is where bloodletting came from. If you had a fever, the doctor would open a vein. If you had a headache, the doctor would open a vein. If you had pneumonia, the doctor would open a vein. The standard treatment for almost every serious illness for over 1,000 years was to drain blood from a patient who was, by definition, already weakened by illness. Bloodletting was the norm. The technical name was venesection. The standard practice was to drain anywhere from a few hundred milliliters to over a liter in a single session. For severe cases, fevers, pneumonia, infections, patients could be bled multiple times in a day, day after day. There was even a specialty of bloodletting devoted to selecting which specific vein to open based on which humor was supposedly out of balance, a practice that required years of academic study to perform correctly. Venesection was taught in medical schools. The leech was added to this arsenal because some humors, the theory went, required gentler extraction. By the 1800s, France was importing over 40 million medicinal leeches annually. There were industrial leech farms. There were leech merchants. There were specialized medical leech jars sold to physicians as standard equipment. Leeches were a major commodity. Modern medicine has retrospectively analyzed how many people this killed. The numbers are staggering. George Washington, the first president of the United States, died in 1799 of what was likely a routine throat infection. His doctors drained around half of his total blood volume in less than 12 hours. He died of hypovolemic shock, blood loss, administered by physicians. Lord Byron, the English poet, died in Greece in 1824 after his doctors bled him repeatedly to treat a fever. The fever was almost certainly malaria or sepsis. The bleeding almost certainly killed him faster than the disease would have. King Charles II of England died in 1685 after his physicians, in the course of 5 days, drained over a liter of his blood, administered enemas, blistered his skin, shaved his head, and applied caustic chemicals to his scalp, and gave him a mixture that included spirits from a human skull. The official cause of death was apoplexy. The actual cause was the medical care. That is not an isolated case. That is the standard of care for the wealthy who could afford a real physician. For over 1,500 years. Now let's talk about what bathing did to medieval European medicine. Around the 13th century, a doctrine took hold in European medical thought that warm water opened the pores. Open pores were dangerous. They allowed miasma, bad air, and plague vapors to enter the body. The doctrinal conclusion was that bathing was risky. The wealthier and more advised you were, the less you bathed. By the 16th century, this had reached its peak. The French surgeon Ambroise Paré, one of the most respected medical figures of his era, wrote that public baths should be avoided because they opened the body to disease. King Henry IV of France was famously rumored to bathe only twice in his entire life. Queen Elizabeth I of England reportedly bathed once a month, whether she needed it or not. The University of Paris medical faculty, when consulted about the cause of the Black Death in 1348, concluded that the plague was caused by a planetary alignment of Saturn, Jupiter, and Mars on the 20th of March, 1345. Their prescribed treatments included bloodletting, avoiding bathing, and burning aromatic herbs. These were not fringe figures. These were the most credentialed medical authorities of their era, advising kings and popes. Now, the question becomes sharper. While European doctors were prescribing bloodletting for plague victims and warning against bathing during outbreaks, what were the Norse doing? The answer is almost embarrassing in its contrast. The Norse system was not a medical system in the European sense. It had no theoretical framework, no university training, no textbooks. What it had was something more powerful, accumulated empirical observation, encoded into ritual, passed down through generations. Take wound care. A Norse healer treating a battle wound did not bleed the patient further to balance humors. She washed the wound with hot water from the bathhouse. She packed it with honey, which we now know contains hydrogen peroxide and methyl glyoxal, natural antibacterial antibacterial compounds active against Staphylococcus and Streptococcus. She covered it with birch bark or birch tar, both of which contain betulin and betulinic acid, confirmed antimicrobial agents by modern pharmacology. She bandaged it with linen that had been boiled. The honey treatment specifically is worth pausing on because it tells you everything about the gap between empirical and theological medicine. In 1991, an Australian researcher named Peter Molan, working at the University of Waikato in New Zealand, began publishing studies on the antibacterial properties of Manuka honey. He demonstrated that medical-grade honey could kill antibiotic-resistant strains of Staphylococcus, including MRSA. The medical establishment was skeptical for years. By 2004, the FDA approved medical-grade honey as a wound dressing. By 2015, the NHS in Britain had it on formulary for chronic wounds. Modern surgeons now use it routinely for diabetic ulcers, post-operative infections, and burn wounds. That is a 1,000-year delay between the Norse healer applying honey to a wound and a modern academic medical system recognizing it as evidence-based treatment. The birch tar story is similar. Modern pharmacology has identified specific antimicrobial compounds in birch, betulin, betulinic acid, and suberin. The compounds are being researched as potential treatments for antibiotic-resistant infections, for certain skin conditions, and even for tumors. The Norse used birch tar topically on wounds, internally for digestive complaints, and in their saunas to release antimicrobial vapor. The Norse arrived at these treatments by trial and error over generations. The medical establishment that ridiculed folk medicine spent 700 years rejecting these compounds in favor of theories that did not work, and then, in the last 30 years, quietly rediscovered them. Take childbirth. Norse women gave birth in the sauna. The room was already heated, the walls were saturated with antimicrobial smoke residue, the water was scalding hot. The birch branches used for cleaning were themselves antibacterial. Knives were passed through fire before cutting the umbilical cord. In medieval European childbirth, the physician, when one was present, typically did not wash his hands. He often arrived directly from another patient or from a dissection. Maternal mortality in European hospitals remained between 15 and 20% through the mid-19th century. That number did not drop until Semmelweis, until Pasteur, until Lister. In Norse settlements, archaeological evidence of mass maternal mortality is essentially absent. The skeletal record shows women living to old age in numbers that should not have been possible under medieval European childbirth standards. This is not romantic speculation. It is what the bones tell us. Step back from the details for a moment. What comes next is the part of this story that almost nobody addresses. Because the obvious question is, if Norse empirical medicine worked better, why did European theoretical medicine win? If you find this kind of evidence-based history valuable, a like genuinely helps the channel reach more people who want it. The answer is institutional, and it is uncomfortable. European medicine had universities. It had Latin. It had royal patronage. It had a clergy that controlled education. It had the printing press eventually, and a continuous textual tradition stretching back to Galen and Hippocrates. It had legitimacy. Norse medicine had none of these things. It had midwives, healers, vulva, liechni, women mostly, with practical knowledge passed orally. It had no Latin texts. It had no universities. It had no king's physician. When the Norse converted to Christianity, between roughly the years 1000 and 1200, the empirical hygiene system began to be replaced by the European theological one. The midwife was replaced by the priest. The bathhouse was replaced by the church. The pagan healing rituals were declared sinful. The healers, who were often women, were eventually burned as witches. The institutional defeat of empirical medicine by theological medicine was not a victory of better evidence. It was a victory of better paperwork. The medieval European medical establishment was not stupid. It had brilliant minds. Ibn Sina, also known as Avicenna, wrote the Canon of Medicine around 1025 AD. It became the standard medical textbook in European universities for 6 centuries. It contains genuine medical insights mixed with Galenic theory. The problem was not the intelligence of the men. The problem was that the framework they were working within did not allow them to test their assumptions empirically. Galen could not be wrong, because Galen was the authority. If a treatment failed, the failure was attributed to the patient, not to the treatment. This is the difference between empirical and theological epistemology. In empirical thinking, when something fails, you change the theory. In theological thinking, when something fails, you blame the failure on the patient, the planets, the will of God, or the impurity of the doctor's intent. For 700 years, European medicine was theological, and the Norse system, with no theory at all, kept producing better outcomes through pure observation and ritual. This was not finally corrected from within the medical establishment. It was corrected from outside by figures the establishment treated as heretics. Semmelweis, who I started with, is the obvious example. He observed that hand washing prevented maternal death. The medical faculty of Vienna rejected his findings because they could not accept that doctors might be the cause of disease. A century earlier, Edward Jenner had observed that milkmaids who caught cowpox did not get smallpox. He developed the first vaccine in 1796 based on this empirical observation. The medical establishment of his time was, for a generation, resistant. John Snow, in 1854, mapped a cholera outbreak in London to a single contaminated water pump on Broad Street. He proved cholera was waterborne, contradicting the dominant miasma theory. The medical establishment did not fully accept his findings for another decade. Each of these figures was rediscovering with scientific rigor what the Norse had already known by observation. Wash your hands. Do not drink contaminated water. Avoid carriers of disease. The empirical knowledge had existed for 1,000 years. Institutional knowledge had to invent it from scratch because it had spent those centuries actively rejecting the empirical. There is a question I want to leave you with because it matters more than the historical case study. We tend to assume that scientific knowledge accumulates over time, that each generation knows more than the last, that progress is linear. The story of medieval medicine versus Norse hygiene complicates that assumption. For 700 years, the most credentialed medical authorities in Europe were systematically less effective at keeping patients alive than illiterate Scandinavian midwives. The institutional structure of medicine, the universities, the licensing, the textual tradition, actively protected wrong ideas from being challenged. What was true for medieval medicine has historical precedent in other fields. Phrenology, lobotomy, the food pyramid, the repeated, institutionally endorsed certainty that ulcers were caused by stress and not bacteria, which delayed effective treatment by decades, was only corrected when an Australian doctor named Barry Marshall drank a vial of Helicobacter pylori to prove it could cause ulcers. That was in 1984. Marshall won the Nobel Prize for it in 2005. The medical establishment that had been wrong did not apologize. This is not an argument against institutional medicine. Modern medicine, properly practiced, has saved more lives in the last 100 years than every folk tradition in human history combined. Antibiotics, vaccines, sterile surgery, anesthesia. These are extraordinary achievements. It is, instead, an argument for epistemic humility. The medieval European medical establishment was not stupid, but it was wrong about almost everything that mattered for 700 years, and the institutional certainty that protected those wrong ideas, the same certainty that ridiculed Semmelweis, that committed him to an asylum, that watched him die of infected wounds, is not a feature of medieval medicine alone. It is a feature of any institution that becomes too confident in its own framework to test it. The Norse had no framework. That was their weakness. In the long term, they could not communicate their knowledge through writing. They could not build on it cumulatively. They could not defend it when Christian Europe arrived with the cross and the sword. But for 700 years, while better organized civilizations were killing their patients with theory, the Norse were keeping theirs alive with observation. That is the part of the medical history textbooks do not tell. Sometimes the deepest knowledge is not the kind that gets credentialed. It is the kind that survives because it works. If you've ever watched an institution defend a wrong idea for years past the point of obvious failure, in your industry, in your government, in your own field, you understand exactly what happened between Norse midwives and Galenic physicians. It'd be curious to hear those examples in the comments. If what brings you here is the real story, the parts the textbooks skip, the empirical wisdom the credentials never recorded, then this channel was built for you. Subscribe and you'll see what comes next. The next time a medical authority tells you something with complete certainty, ask yourself one question. Is this evidence or is this theory? Is this the result of patients getting better, or is this the result of the framework demanding to be right? The Norse couldn't have answered that question in those words, but for 700 years, they answered it with their practice. They washed, they observed, they kept what worked. And when the European medical establishment finally caught up, through Semmelweis, through Lister, through Pasteur, it was rediscovering knowledge that had been quietly carried in habits for 1,000 years. Sometimes the smart thing a civilization can do is admit it doesn't know. And sometimes the most dangerous thing a civilization can do is decide that it does.